Hello everyone, this is Dr. Aditi and today we're talking about our spine or the vertebral column. We're going to talk about the different curves, regions, different types of vertebra, what are the characteristic features, ligaments, and of course disorders. And then we're going to sort of summarize it all and pop it into a mind map so that you have one sheet of paper that sort of has everything we talked about in this episode, and it's a great study tool for you. So let's get cracking. So the adult vertebral column actually consists of 34 vertebrae in total. However, there's a caveat, right? In the sacrum and the coccyx, which is that green part, that's the sacrum, and the coccyx is the red tip, some of those vertebrae are fused. So what we actually delineate is that we have 24 vertebrae plus the sacrum plus the coccyx, right? Because this is sort of like the movable parts of the vertebral column. Now there's different regions of the vertebrae. We've got the cervical region. This is going to be 7 of them, and C1 to C7 is how it's delineated. And then we've got the thoracic, which is T1 to T12 vertebrae. And the lumbar, which is L1 to L5. Simple enough, right? And then of course we've got the sacrum and the coccyx that we've already talked about. Now, I want you to look at the profile view of this skeleton that we see in the visual, and you can see that the vertebral column is not like a straight line, right? There are these sort of curves to it. And there's a reason for that, because it sort of acts like a shock absorber, and it also gives us a lot more flexibility, right? If it was a straight line, it would be more prone to fractures, and obviously we would not have the flexibility that we take for granted. So the vertebral column actually has several curves. Well, there's 2 primary and 2 secondary. So the primary curves are going to be in your thoracic area and your sacrococcygeal curves or area. And then we've got 2 that are secondary, which is in your cervical and then your lumbar region. Okay, so that's curves. All right, let's move on. Well, you might be wondering, how am I supposed to remember these regions of the vertebral column? Well, of course, we've got a mnemonic for you. So the first part is, ate a bowl of cereal for breakfast at 7. So that's your C7, 1 to 7, which will be your cervical vertebrae. And then we've got tasty lunch at 12, which basically means thoracic vertebrae, and there's 12 of those. Then we've got light satisfying dinner at 5. So light, or L, is for lumbar, S is for sacral, and they're both going to be 5 vertebrae there. And then of course we've got chips as a snack at 1. So chips basically means it's coccygeal, and 1 basically means 1 vertebrae here. So it's actually 1 fused vertebrae, but there you have it. Here we're looking at parts of a typical vertebra. So obviously you've probably figured this out, that depending on the region of the vertebral column, the vertebrae are going to look different. And you're right, they are, because they have different functions, right? But there's this sort of basic structure of a vertebra. That's what we're looking at here. So a typical vertebra consists of, well, here's the superior view. So it consists of the body. That's going to be in the anterior portion. And then it has something called a vertebral arch, which is the part that is underlined in blue, which has paired pedicles and laminae. Now, arising from the vertebral arch are several processes: transverse process and the spinous process. And you can actually palpate and feel these on your own spine in the back, right? Then you've got the vertebral foramen, which you know by now is a passageway for the spinal cord. Then we've got several facets. You've got the superior articular process, inferior articular process, and the facet for the head of the rib. That should give you a clue. This is basically, these are the areas where the rib will articulate with the vertebrae, right? Or vertebra. Okay, Now, the other thing you want to remember is there is another foramen, which is basically where the spinal nerves will exit, and this will be through the intervertebral foramen, which are located between these adjacent vertebrae. Now, of course, the other thing that I didn't highlight here, but intervertebral discs are sort of the cushioning that you have between vertebrae, right? The adjacent vertebrae. So that's the other key component here. So what exactly does an intervertebral disc look like, and where is it located? Well, I think we've already talked about it somewhat. It's located between adjacent vertebrae, right? And the whole point of it is that it offers a cushioning or padding and allows for movement between adjacent vertebrae. Because if we didn't have that, we'd have some abrasions and we'd have some problems with our spine, right? So it gives it that sort of fluid mobility and cushioning, right? Now, if I can orient you to the visual here, you've got your vertebral body, and then you've got your intervertebral foramen, which is basically where the spinal nerves will exit. And then you've got the intervertebral disc, which is in this light blue. Now, there are two components to the intervertebral disc. There's the outer layer, which is very fibrous. It's called the annulus fibrosus. And then we've got an inner sort of more gel-like layer or center, and that's actually called the nucleus pulposus. I just think those names are just so fun to say. So just to keep things entertaining, right? But basically, that's essentially what the intervertebral disc is composed of. It's sort of sandwiched between two adjacent vertebrae to allow for cushioning and movement. Now what we want to do is look at each type of vertebra a little bit more in depth, right? Because for the most part, the regions have vertebra that are homogeneous. They all look the same. But the cervical vertebra are a little different. They have some unique vertebrae, especially C1 and C2, and even C7's a bit different. So let's take a peek at that. So we've got your typical structure of the cervical vertebra. That's what it's going to look like. But then you've got C1, which is the atlas. It looks a little different because it actually holds our head, right? And it looks more like a ring structure. It doesn't look anything like the typical vertebrae, honestly. It just looks very different. And then you've got the axis. That's C2. That's also different because that actually holds the C1 on top. And that has this projection, which is the dens, that enables us to rotate our head. So C1 lets us say yes, and C2 helps us with rotation, and that's why their structures are different. Now C7 is also a bit different, not vastly different. It just has a bit of a longer spinous process. So I just want you to be mindful of that. Because that makes it a little bit unique, and it's actually because it's transitioning into the thoracic vertebrae, and you'll see that distinction soon. But basically now what we're going to do is look at some models of vertebrae, each one of them, cervical, thoracic and lumbar, and I want you to sort of understand the key features, but also the distinguishing factors and just the difference in size, because that's going to help you sort of navigate learning them. All right, so let's do that next.
Here we have the typical cervical vertebrae, which you would see basically in the cervical area, which is C1 to C7. Now, of course, the caveat here is C1 and C2 look very different, and C7's are a bit different too, but it's got essentially the same sort of characteristics. So it's the smallest and lightest vertebrae, very delicate compared to the others. And the first thing you'll notice is these tiny holes. These are the transverse foramina, and these will allow vertebral arteries to pass through and supply blood to the brain. Okay, and then you've got this sort of bifid spinous process, sort of like a forked tail, and that's going to serve as a muscle attachment area to allow movement. Okay, then we've got this sort of larger foramen in the middle, and this is triangular, and it's a hole for the spinal cord, right? Because it's going to be a little thicker near the brain, right? Okay, and then we've got some other sort of landmarks. So let's take a peek at those. Of course, these are your spinous, your superior articular processes. And then we've got the lamina right here. And then if you look over here, this is your transverse process, right? We already talked about the transverse foramen. And then, of course, you've got this pedicle area and then the groove for the spinal cord. So essentially, this is your typical cervical vertebrae. Now, the difference in the C7 is that the spinous process is a lot longer and more prominent, right? And you can actually feel that at the base of your neck. If you just palpate in that area, you'll feel that sort of longer spinous process, because that's where things are sort of changing and we're transitioning into the thoracic vertebrae. All right. This is your C1, Atlas is the name, and this name actually comes from Greek mythology, where Atlas held up the sky, basically. And the C1 vertebrae holds up your head, so it's the same sort of concept, right? Now, it's a little different than your typical cervical vertebrae because it doesn't have a body and it doesn't have a spinous process either, right? And because it's designed to support your skull, so it looks very different. What it does have is sort of this ring-like structure, and it's got an anterior arch over here, and then we've got a posterior arch, and the transverse processes are very elongated compared to the typical cervical vertebrae, right? And what it does is it sits on top of the C2 vertebrae, which is right here, and it basically allows you to nod your head yes, like this, per se. Okay, so that is Atlas C1. This is the axis, C2, cervical vertebrae 2. As you can see, it looks very different than your typical vertebrae because it's got this distinguishing feature, which is the dens. Now, this sort of looks like a tooth, right? Sticking out, a projection. So it's actually also called the odontoid process. And this is actually a projection that allows us to rotate our head, because here you've got the C1, and that actually sits right on top these are the superior articular facets, and this sits right on top there, and it sort of has this gliding movement so that we are able to rotate our head and say no, for example, right? So that's how it articulates with the C1. Now you can see that it's very robust compared to the other cervical vertebrae, you know, because it's going to be weight bearing, and so it needs to be a lot more stable. So you can see even the tail, the bifid tail, I mean, it still has that fork, but it's a lot thicker than the other vertebrae. Right, so it's very important because it allows us to rotate our head, and injuries to the dens, like for example in whiplash or whatever, can be really dangerous because right behind the dens, what is it? We've got this spinal cord, right? So we really need to be careful with that joint.
So we've covered the cervical vertebrae, and you can see how many variations there were just from C1 to C7, right? But now we've got sort of a homogeneous group of vertebrae in their region. So the thoracic vertebrae, they all sort of look the same. There's no distinction between T1 or T2. They're all sort of the same. And then you've got the lumbar, and again, they're a homogeneous group. They're all going to look the same too. So I wanted to sort of show you some of those key characteristics of both these vertebrae, but I also want you to pay attention to how they look, how varied and different they look compared to each other. So let's take a peek.
These are the three types of vertebrae found in the body. So the first one is your cervical, thoracic and lumbar. And as you can see, the thoracic is right in the middle, just like in the spinal column, the thoracic is going to be right in the middle of the spinal column. And if I turn it to the side, just right angle, sort of looks like a giraffe, right? So the long spinous process looks like its nose, it's sort of in this downward projection. And then these right here are your transverse processes, which look like ears, right? And then even these little mounds, which are basically your superior articular facets, they look like little mounds or antennae almost. I don't know the technical word, but basically that you see on top of the giraffe's head. So that's an easy way to sort of identify the thoracic vertebrae. Now this is going to be from T1 to T12, and remember they're going to have a lot of articulating surfaces for the ribs that sort of join here, right? Because the big role they have is to protect the heart and lungs. Okay, now another thing is to look inside the foramen. This is more circular compared to that triangular foramen that we found in the cervical vertebrae. So that's another distinguishing factor. Okay.
Before we move on to the lumbar vertebrae, I want to touch on the rib articulation in thoracic vertebrae. It's not only is the articulation important to understand, but the reasoning is important, right? So you know that thoracic vertebrae have a superior and inferior, those articular facets, right? They have both those. And it's on the vertebral body, and that's what articulates with the head of the rib. So let's take a peek here. This is the rib, and you see the top is the head of the rib. But there's also that transverse process facet for the articulation with the rib tubercle right there. Now, you know, this is how it attaches, but there's a reason for this. And the reason is that these the way the attachment is to the thoracic vertebrae allows us to do a lot of rotation with our trunk. However, it limits excessive flexion and excessive extension, because that would not be good, right? So the thoracic region is very strategic in how it sort of has this articulation, and it's actually the rib attachments that prevent us from excessively extending or flexing. And now when we look at the lumbar vertebrae, it's actually going to be the opposite. They allow for flexion and extension, but they have some limitation with rotation, because that could cause some problems in the lumbar region. So it's such a clever model, honestly. It's quite brilliant if you really think about it. And you know, when I wake up at 4 a.m, sometimes I think about these things, but that's who I am. Anyway, moving on.
So again, we have the cervical, thoracic and lumbar vertebrae. These are the vertebrae found in our spinal column. And now we're going to look at the lumbar. As you can see already, it is the sturdiest and thickest of all the vertebrae. This will be your L1 to L5. They support most of your body weight and are responsible for stability, flexion, and extension. Now, if you look at it from just right angle, this sort of side profile, you can see that it looks like a moose, right? It's quite uncanny actually. The spinous process has this sort of little angle here and projects downward a little bit, but then also horizontally. So it sort of looks like the moose's snout, you know, the big snout that a moose has. And then of course the transverse processes are on either side, and they look like the antlers, as do the superior articular processes. You know, it all sort of looks very much like a moose. Not that I've seen one in person, but that's what it sort of looks like, right? Now, if we look at the body of the vertebrae, again, it's very thick. It's this massive kidney-shaped body, and basically it's designed to withstand heavy loads, right? And the spinous process is short. It's not that sort of long downward spinous process that we see in the thoracic, because there's no attachments here. There are no rib attachments here, which basically means that This type of vertebrae allows for greater flexibility in bending and twisting, right? And the lumbar spine is, it's like a, what's the word? Like a flexible hinge almost that allows you to bend forward, backward, side to side. So it really is designed for that flexibility. And then of course the foramen look very different because again, it doesn't have the round foramen that we find in thoracic, but it has more of that triangular foramen that we saw in the cervical area. So again, these vertebrae allow for flexion and extension, bending forward and backward, but also they limit rotation, right? Because then that would cause, that could cause injury. So it also has a preventative feature.
Right, so we've covered the cervical vertebrae, that C1 and C2 are a little different, atlas and axis, and then we've got the thoracic, which look like giraffes, and we've got lumbar that look like moose. And now we're moving on to the last two, which basically are the sacral and coccyx. And remember, these are fused, so they're going to look wildly different because all the vertebrae have been fused into one movable component. The very last part of the vertebral column is the sacrum and the coccyx, right, which are both located on the base of the spine, and they connect the vertebral column to the pelvis. They do several things. Even though they are the smallest part of the vertebral column, they provide stability, help with weight distribution, and also have attachment sites for muscles and ligaments, right? Now the sacrum is like this triangular shield is what I think of. I think of it like a shield of the spine because it's this large triangular bone and it's made up of 5 fused vertebrae. Now what it does, it connects things. It connects the hip bones, the ilium, via these sacroiliac joints, and it forms what we call the pelvic girdle, right? Now, some of the unique features of the sacrum, and here we have an anterior view. I'm just going to go over a few unique things. First of all, we've got the sacral promontory, and this is the top edge of the base of the spine. So you can actually palpate that. Then we've got the sacral foramina, which are holes, as you know, and they allow nerves to pass through. And then we've got auricular surfaces. Now these are important because this is where the sacrum actually meets the pelvis. There's that connection right there, that articulation. Then we've got 2 structures, the sacral canal and the hiatus, right? These both are the continuation of the vertebral canal in a way. And then they end at the coccyx or tailbone, which is what we're going to talk about next. Now, the coccyx is a triangular bone again, and it's made of 3 to 5 fused vertebrae, right? And it is a vestigial structure. What does that mean? It means that it was sort of like a leftover remnant of evolution. From when humans had tails, I guess. So the function of the coccyx, though, is still very important. It supports with sitting posture. It's hard to believe this little thing helps, but it does. It acts like a base when you sit down. It's also an attachment site for ligaments and muscles. For example, it connects to the gluteus maximus and also some pelvic muscles. And it also helps with balance and movement. I kind of think of it like a top. If you've ever played with a top, it has the same sort of look, and how a top can balance on its own. It's quite phenomenal if you think about the mechanics of it all. But anyway, it also helps with shock absorption, right? And helps you sort of distribute that weight so you don't fall backward. Anyway, that's basically the story of the coccyx. Now, the one thing I wanted to mention is the sacrum actually starts as separate vertebrae but fuses by adulthood. So around 30 is when it's fully fused. So just another fun fact to note about the sacrum. Let me ask you this. Are you a yoga person? Do you do yoga or any sort of core exercises, stretching or strengthening? If you are, what you are doing is really sort of targeting ligaments of your body to keep them flexible and stretchy, to prevent sort of chronic back pain or herniated discs and all that. That's what all these exercises do. Like, the whole world seems to be doing yoga right now, and a lot of them probably don't know exactly why, but now you do. Basically, exercises like yoga help maintain healthy ligaments. What are ligaments, and why does that even matter? Well, ligaments are tough, fibrous tissues that connect bone to bone. In the vertebral column, they help several things. They maintain alignment, like that postural integrity, limit excessive movement, and absorb shock. That's why when your ligaments are really tight, it can lead to so many sort of diagnoses and injuries of the spine. So the key ligaments of the vertebral column, well, there's several. One is the anterior longitudinal ligament, and you guessed it, this runs along the front, and it prevents hyperextension, i.e. excessive backward bending, right? It's in the front, so you know it's going to prevent that because it's going to pull you forward. Then we've got the posterior longitudinal ligament, because if you have anterior, there's probably a posterior, and that runs along the back of the vertebral bodies, and it's actually going to be inside the spinal canal. Now, this prevents us from bending forward too much, i.e. prevents hyperflexion, right? Then we've got something called the ligamentum flavum, which sounds like bubblegum to me, but basically this is an elastic band. And what it does, it connects the laminae of adjacent vertebrae together. And because it's elastic, it has these elastic fibers that allow it to, like a rubber band, sort of be flexible and recoil, right? Stretch and then regain its shape. So that's very important for laminae, because especially when they're adjacent to each other, you want them to go back into the right spot. Then we've got something called interspinous and supraspinous, and the name should tell you everything. Interspinous ligament, this runs between spinous processes, right, between one vertebrae and the other. And then supraspinous ligament, it runs actually along the tips of the spinous processes. The supraspinous ligament connects the spinous processes of thoracic and lumbar vertebrae together. Now, in the posterior of the neck, the supraspinous ligament enlarges to form something that's called the nuchal ligament. Now, the nuchal ligament is a little special because it attaches to the cervical spinous processes and the base of the skull, right? So you've got the supraspinous ligaments that connect the thoracic with the lumbar, but then you've got the nuchal ligament which connects the cervical spinous process to the base of the skull. Now, do you remember the base of the skull? You have that nuchal line. That's where that ligament would basically join. Okay, and what does it do? It prevents excessive spinal flexion, basically bending forward too much. Okay, then we've got now listen to the name, intertransverse ligaments. Remember the transverse processes, the projections that sort of stick out of that vertebral arch? Well, these connect the transverse processes of the adjacent vertebrae, and it prevents us from bending excessively to the sides. That should clue you in, because remember, transverse, they're sort of on the sides. If you think about their positioning, it tells you that it prevents excessive side bending. So again, why do these ligaments matter? They prevent injuries, keep your back stable during any sort of activity of movement. Damaging or any weakening of these ligaments can lead to a lot of instability, herniated discs, or chronic back pain. And basically, when you have those conditions, you go see a PT and they help you with that stretching and strengthening exercises to help your ligaments be more flexible and strong and help your spine out. Well, what happens when things go wrong? Remember those curvatures we talked about? They're very specific types of curves. Too much or too little is going to cause a lot of problems. So that's what we're looking at here. The first picture, the x-ray that you see, that is scoliosis. Now that is the lateral bending of the vertebral column. That is not a natural curvature. So, you know, as an OT, I see this a lot in children with spina bifida, for example, right? You're going to see that sort of S-looking spine. Then the next one is kyphosis. This is the excessive curvature of the upper thoracic vertebral column, right? That's when you see that sort of hunchback of Notre Dame type of look. And then we've got lordosis, and like the name implies, this is excessive curvature of the lumbar region of the vertebral column, and we do see this often when during pregnancy. You will see this, and hopefully it all sort of, you know, recoils back, but this is something you do see and is very common. What about herniated discs? Now, that's also a part of when things go wrong, right? So if you remember the picture of a typical intervertebral disc, it has this sort of fibrous lining outline, right? And that's called the annulus fibrosus, and that's this tough fibrous outer ring. And then the inside is more this gel sort of substance, and that's the nucleus pulposus. So what happens is basically the weakening of that fibrosis can result in herniation or protrusion of the nucleus pulposus. That gel sort of shoves out, and then it compresses the spinal nerve in the intervertebral foramen. This results in pain and or muscle weakness, and obviously depending on what body region that nerve supplies, that's also going to impact that body region, right? So this is essentially in a nutshell what a herniated disc looks like, and it's quite prominent. You can see that in the x-ray shown here. A quick recap using our mind map of the vertebral column. There are a total of 33 vertebrae, but they're delineated as 24 vertebrae, and then the sacrum and coccyx, which have more fused vertebrae. And then we have a mnemonic for you on the other side, and this basically helps you remember the regions of the vertebrae and the number. So it tells us that we have 7 cervical vertebrae, and these are going to be a lot smaller and delicate. They have a triangular foramen, and they have C1, which is different, and C2, which is different. C1 is the atlas, sort of holds your head and helps you nod yes. C2 is the axis, helps you with rotation to say no. And then we've got 12 thoracic vertebrae, which look like giraffe. Their foramen is round, and they basically really help with rib attachments in the thoracic cage, and they promote rotation but prevent us from bending forward and backwards excessively. Then we've got the 5 lumbar, which look like moose, and they have a triangular foramen, and they have very sturdy kidney-like bodies in their vertebrae. That's because we need it for weight bearing, so they tend to be the heftiest vertebrae in the category. Then of course we've got 5 sacral and coccygeal, and these are going to be your fused vertebrae. The sacral actually forms the pelvic cavity, and the coccygeal, even though it's remnant of evolution, you know, it's a vestigial structure, which basically means it's sort of left over. It helps us with postural control in sitting. Okay, then we've got the basic structure of the vertebrae, and we also have disorders. We've got scoliosis, where your spine looks like an S. Then we've got the kyphosis, which is like the hunchback of Notre Dame, and we also have lordosis, which is basically where your lumbar vertebrae curves more than it should, and that is prominent during pregnancy. There you have it.